Hello, it's Dr. Erica, pharmacist. Thank you for joining me on this particular video. Please like, share, and subscribe, and stay tuned to the end of the video. Thank you for joining me. Hi, it's Dr. Erica, pharmacist. I'm going to talk about some health tidbits, just in general, to help you get a better conscious understanding of better health, daily health routine. The more familiar you become with your daily routine, the more easier it becomes, and it becomes a better and a general habit for you. You know what to do every day for your health. Okay, it can be nutrition, it can be exercise, it can be rest, it can be spending time in a meditation environment. It can also be spending time with groups of people to help increase, for example, those neurotransmitters that are joyous, like dopamine and serotonin and oxytocin. Also, you want to be where and do things in a routine that helps your daily habit. Okay, so first I want to talk about mental status. Let's start from the top to the bottom. Mental status, right here. Okay, your mental state is going to be a crucial and important aspect of your health. Okay, we suffer in our old age with dementia and Alzheimer's. Okay, to prevent symptoms of dementia and Alzheimer's, it's good to do some reading, do some puzzles, do things that help stimulate your mindset. Being active with your body can help your brain as well. And then also just being in communication with other people, learning new objects and new things can help your brain to grow and build a thicker network in your brain, releasing good neurotransmitters, causing a euphoria and a sense of pleasure and establishment and wellness. Okay, so the brain, let's work on the brain first. Okay, do things that are positive, think thoughts that are positive, do affirmations on a daily basis, do meditation and prayer on a daily morning basis to help get your brain stimulated and working well. Also, you can do nutrition determines the actual networking of the brain. The more nutritious your meals, the healthier your brain networking. Okay, you want to refrain from high cholesterol, high fatty foods, because that also contributes to dementia and Alzheimer's. Yes, cholesterol has been identified in research as a possible cause of dementia and Alzheimer's. So watch your nutrition, watch your cholesterol intake, watch your fat content as well. Also, you want to, besides the brain, you want to make sure your eyes, your ears, your nose, and your mouth are healthy as well. You don't want any type of boils or any type of irritation going on in those membrane areas, because guess what? Your brain is right there. Whatever infection occurs in the eye, the nose, the throat, the ear, those infections, they travel. Bacteria, fungus, all of those entities that cause infections, they travel to the lungs to cause pneumonia as well. Did you know that? And also they travel to the brain, and then they become larger and more difficult to treat once they begin to travel and hone in on different organ systems. So do be knowledgeable and notice changes in your cranium, in your body. Okay, next I want to talk about, let's move further down. Let's talk about the lungs and the heart, the torso of the body. Okay, now the heart, again, is affected by our nutrition, what we feed ourselves, the amount of calories, and also the amount of cholesterol that contributes to the dilation of our coronary arteries and our blood vessels. All of that plays a role in diabetes production and it plays a role in clogging of the brain and the heart itself, leading to stroke, hospitalization, myocardial infarction events, such as heart attack as well. So we want to be mindful that our heart is also important. Now, the lining of the heart is important as well. We want to make sure the lining of the heart is not inflamed. We want to make sure that we're taking our vitamins, our omega-3 fatty acids for heart protection. And then we want to also exercise. Exercise is second to nutrition when dealing with a healthy heart. We want to increase our blood flow and output, and we want to increase the heart rate to 70 to 80% of this max rate in order to get that heart in a healthy and normalized functioning. Your heart will change over time when you begin to exercise. It becomes stronger, it pumps out more fluids, and it's less at risk for retaining unwanted fluids. Okay, the structure of the heart becomes, the muscles that line the heart become stronger, thicker, more productive, and that's what we are looking for. So that comes from our weight resistant exercises and also our cardio exercises. Cardio exercises are number one when helping the heart to thrive and be better. Okay. Also, we want to make sure our lungs are healthy. Okay. We want to make sure our lungs are performing very well. We want to refrain from tobacco use. We want to refrain from cancer. We want to refrain from also pneumonia and emphysema, COPD. All of those are caused by tobacco use. And COPD, or chronic obstructive pulmonary disease, can be prevented when a smoker decides to quit smoking. Okay. And also, we want to recommend that patients also exercise. That helps get the respiratory rate up, and you begin to have more ventilation in your lungs, more airflow, and so forth. Okay. And then also during the flu season or during the cold season, make sure that you are being vaccinated for pneumonia, vaccinated for influenza virus, because those viruses are prominent in causing pneumonia and lung problems. Okay. And we don't want that. So vaccinations are available to help reduce lung problems. Okay. And again, like I said, if you have sinusitis infection or ear infection or eye infection or throat mucus, those bacteria, again, they travel to the lungs, causing pneumonia, causing phlegm, cough, congestion, putting patients in positions to where they have to go into the hospital for treatment and receive antibiotic therapy and steroid therapy. Okay. Preventable care. This is preventable measures. Okay. So that I'm giving you. So do make sure that you are exercising, proper nutrition, vaccinations, and just preventing. Okay. These are daily habits that you can incorporate into your life now in order to prevent further disease states. And then also I want to talk about, besides the brain, the heart, the lungs, we have the pancreas. The pancreas produces insulin from beta cells. Beta cells are the cells of the body that produce insulin. And when they stop producing insulin, the patient becomes insulin resistant, also known as diabetic. Okay. Diabetes is a cause of many different types of problems in patients. Diabetes leads to blindness, it leads to kidney disease and malfunctioning, and then it can also cause amputation, unwanted wound healing, and or wounds not being healed, and then skin openings. So that's what diabetes can cause, and we don't want that. Okay, so we want to make sure that you're exercising and that you are burning fat so that your body can produce more insulin and your body can lose weight. Okay, so when you begin to gain weight, and store fat, the body has to keep up, that pancreas has to keep up with the amount of fat and glucose and sugar intake. So that's a lot of work for the pancreas. So the body becomes a type 2 diabetic, okay? So we don't want that. We want to make sure that we're, again, watching our cholesterol contributes to diabetes too, unfortunately. And then we want to also, besides the pancreas, make sure we're doing healthy things for our liver. We're refraining from over consumption of alcohol. We're refraining from over exertion of our liver, again, through alcohol use and abuse. And then we want to make sure that we are drinking plenty of water throughout our day to flush out our organ systems. It's recommended that patients drink at least eight ounces or eight glasses of water per day. It might seem like a lot. I think it's like 10 to 30% of a person's weight they should drink in water. But do drink plenty of water throughout your day. And that also reminds me, the kidneys. The liver is one organ system, helps filter out the blood, cleanses the blood. The kidneys also cleanses the blood as well, reducing waste, and then of course causing defecation and urination. Okay, so we want to make sure our kidneys are healthy by drinking plenty of water, refraining from high cholesterol and high blood pressure, because our kidneys do have arteries inside. They have arteries and veins inside, okay? We want to make sure that we're healthy in all of our veins and arteries. And we want to make sure that we're flushing our kidneys, flushing and making sure we're not diabetic, because diabetes patients eventually have kidney problems as well, because we have glucose trying to get through the kidneys. Like, for example, when you have glucose pushing through the kidneys, those larger molecules are causing a detrimental effect on those arteries over time. Okay, so we want to make sure that we're eating properly and drinking plenty of fluids, and refraining from being a diabetic. Okay, and then also kidney stones. I want to talk about kidney stones. Kidney stones can be prevented by eating certain nutritional meals, and also by flushing the urine, reducing the amount of calcium stored in the kidneys, and also reducing the amount of salts that are stored in the kidneys. These kidney stones are salt molecules that begin to harden and to form because they're not being flushed properly, or they're growing at a rate that they're not being flushed at all. So I want to make sure that I let you know that kidney stones can be preventable with proper diet, decreasing the amount of salts, increasing healthy foods, refraining from a whole bunch of potassium products like bananas and so forth, which are good in taste, but we want to make sure that we're honing in on a diet that is good for our kidneys specifically. Okay, so let's talk about our waist circumference. Okay, our waist circumference should be 30 inches for females and 40 inches for males or lower. Okay, I'll say that again. Our waist circumference should be 30 inches for women, 40 inches for men or lower. Okay, the waist circumference is going to determine a patient's or a person's overall health. It's going to determine heart health prognosis, lung health prognosis, in life general. Okay, so it's very good that you keep a waist circumference that is tolerable and manageable, and that waist circumference is going to be determined by the amount of fat that sits on the abdomen. Okay, the amount of fat that sits on the abdomen. I'm not talking about someone being pregnant or anything like that. I'm talking about the amount of fat stored on the actual waist, on the belt of the person. Okay, that needs to be at a very, very minimum if possible. I recommend crunches, exercising, ab roller, daily walking, jogging helps the body to maintain a waist circumference that is healthy and strong. Okay, so I want to make sure that we're eating healthy, reducing fats, cholesterols that are stored, and that we're also exercising daily. Okay. Next, I want to talk about BMI, body mass index. That's the ratio of lean muscle to fat content in a person. It determines whether the person is obesely or headed towards death because of high weight, whether the person is just generally overweight, or the patient is at a good weight, or the patient is underweight. Okay, so the body mass index is a calculation that can be performed by healthcare providers, such as pharmacists, and they can determine and let you know where you stand. A body mass index of around 29 to 30, 31, or maybe 29 to 30 is one that is considered average. And so a patient may be able to maintain that particular average to have a healthy body mass index and a better outcome. Okay. Now, a person that has a morbidly obese BMI can be placed on a treatment regimen, such as 6 months of cardio exercise, 6 months of nutrition from a dietitian, and then also they can be placed on monitoring. And then after the 6 months, they'll be evaluated, and the doctor will decide whether or not they should receive medication for weight loss. Then, if medications are not appropriate, then the patient will receive a surgery or a bariatric surgery option. Okay, if those first options are not, performing or give the outcome that will give the patient a healthy lifestyle. Okay, so do be mindful of that. Now, besides waist circumference, BMI, let's talk about the muscles, the knees, arthritis. Let's talk about also the joints, okay? The femoris connects to the patella of the kneecap, and then we want to exercise. We want to make sure those muscles are being utilized and that we're eating proper nutrition, our fruity berries and our green leafy vegetables. And then we want to make sure that we're doing water aerobics or cardio exercises that will help those joints in those areas. The more we use our patella and our joint system, the longer they last. We build our cartilage. We keep all of that healthy. And then there's also supplements over the counter that you can be using, such as glucosamine and chondroitin. And then there's also turmeric as well that I can recommend for joint health. And they are over the counter. And they also help build your cartilage so that your bones, that bone, that femoral bone in your leg, is not beginning to close in on the patella. Is not beginning to close in because the cartilage has been deteriorated over time. And so I don't want to talk about knee surgery, although knee surgery is very popular here in the last decade. Knee surgery is a risk. I've heard good stories about knee surgery. I've heard some not so good stories about knee surgery. It's just depending upon the patient and how the patient decides to go about their lifestyle at a certain point. Okay, so I want to introduce glucosamine chondroitin and also a vigorous exercise routine. Okay, there are some exercise routines where you can sit down and actually exercise. There's some exercise material where you can just lay on your back and work your knees and work your stomach area. You don't have to always be up and working out where you're putting more pressure, but you can be in a state where you're comfortable. Okay, working out doesn't always mean being uncomfortable. It can also mean being comfortable and feeling good. Okay, and then also I want to talk about, besides joint health, I want to talk about the feet. Okay, the feet is very important as well. We want to make sure our toes and the inner part of our toes are healthy, okay? Fungal free. Nails are fungal free as well. Bacterial free, odor free. Odor is an indication of bad hygiene and unhealthiness. Okay, so and also we want to make sure that there's no discoloration of our nails and between our toes. Okay, so we want to wash with a good soft soap and warm water, and we want to do that regularly, especially after athletic events, especially after working out. We want to make sure we're using. We can also use sodium bicarb as well to help cleanse between the toes, help remove dead follicles, dead skin, and make sure we're cleaning under our toenails, okay? Make sure we're cleaning the bottom of our toenails. And then after cleaning and properly drying, we want to make sure we're applying a good lotion to our bottom of our feet and our ankle area and our feet itself to be sure that the skin remains moist and remains keratin healthy. And we want to make sure that, especially diabetic patients, we want to make sure that there's no open wounds on the bottom or any part of our feet, okay? Because I've seen some situations where patients have had amputation of toes and amputation of body parts because of open wounds not being caught in time or not being taken care of. So I do want to make sure that I mention the feet, okay? The feet are very important, just as important as any other part of the body, okay? The body systems work together to help us live long and help us to do what we need to do on a daily basis, okay? All right, so the skin is the next organ system I want to talk about. The skin is an immune system defense, okay? So the first thing your body is going to do is repel the attack from a virus or bacteria. How? Through the skin first, the mucous membrane, the skin, all your whole body system on the outside is a immune system defense. Okay, take care of the skin, wash it thoroughly, dry it thoroughly, apply moisturizer to it. Also, alcohol, ethanol alcohol, 70% I would recommend, or 80 or 90% will help cleanse off the skin, leaving a cooling effect. Also, sanitizer, which contains the rubbing alcohol as well, will help with that as also. And then also Cetaphil, or Cetaphil is a brand name lotion that I have and can vouch for. Also, Aveeno lotion. You have the baby oil as well, and then you also have the oatmeal type lotions that are very healthy. And again, you can try Burt's Bees products, and then you can try the O'Keeffe's products. O'Keeffe's products are very healthy too because they have petrolatum inside that is thicker and helps to repel moisture and decreases the risk of blistering on the palms of the hand. So I do recommend O'Keeffe's as well. And then there's also powders that you can use to help maintain moisture in the skin and then reduce perspiration. So products that I can recommend are going to be the Blue Star products, and then also antiperspirant deodorants to help with moisture control and odor control as well on the skin, as to help with with better control. Okay, and then the skin in those not so obvious places need to be treated as well. When you're shaving, there are certain products like Skintimate that have fragrances and moisturizers in them that will help reduce cuts and abrasions. So I do recommend that for shaving, especially in places that are not so obvious. And then also getting a professional wax can help with skin preservation and also keratin production. So do be mindful of treatments through the waxing. Going to a waxing salon can help as well. Okay, so I want to leave you with those healthy tidbits, starting from head to toe. And if you have any questions or comments, please let me know. And I hope to see you on my next video. This is Dr. Erica, pharmacist, signing off. Take care.